Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Postvagotomy diarrhea. This is the diarrhea which occurs after vagotomy. That is, almost 30% of the patients 30% of patients suffer from diarrhea after gastric surgery. Actually, if you remember, if this is the stomach, the vagus nerve, the right and left vagus, both of them will actually give a hepatic branch, and they will give a branch to the celiac plexus. This branch to the celiac plexus is necessary for controlling the gastric motility, that is for sympathetic supply. But here, whenever you do a truncal vagotomy, these both are lost. So as a result, the patient will have diarrhea. In most of the patients, this diarrhea is not severe, but it usually disappears in 3 to 4 months itself after vagotomy. But in this vagotomy is actually associated with alterations in stool frequency. If we do a truncal vagotomy, in truncal vagotomy, there is always increased stool frequency is seen. In truncal vagotomy, there is actually increased frequency of daily movements are seen, and these are seen in around 30 to 70% of patients. So in 30 to 70% of patients, increased frequency of daily bowel movements are seen in truncal vagotomy. Right? Next, if you see the treatment of vagotomy, post-vagotomy diarrhea, the treatment of post-vagotomy diarrhea is this post-vagotomy diarrhea actually resolves over time. If the symptoms fail to resolve, if the symptoms of the post-vagotomy diarrhea fail to resolve, then we can give the patient cholestyramine can be given to the patient. What is this cholestyramine? Cholestyramine is actually an anion exchange resin, and this cholestyramine, which is an anion exchange resin, it will absorb the bile salts, rendering them or making them unabsorbable and inactive. So this cholestyramine is an anion exchange resin which will absorb the bile salts and making them insoluble and inactive, and this uh, bile salts are one of the responsible for uh, post-vagotomy diarrhea. So once the bile salts become unabsorbable and inactive, so obviously they will have a better thing. Then we can also use octreotide can also be used if there is this octreotide can also be used, especially if there is severe post-vagotomy diarrhea. We can use octreotide.
thank you and thank you for watching.